Hello, dear friends. Today we're going to talk about gallstone disease. What is it? Can it be treated? And how to prevent it? First, let's look through some information about anatomy and physiology. We need bile to digest food. It dissolves fats and activates pancreatic enzymes. When food enters the duodenum, cholecystokinin is released, causing bile to be secreted into the duodenum. In response, a hormone called cholecystokinin is released from the wall of the duodenum. It stimulates the gallbladder to contract, and bile flows into the duodenum. Bile is produced by liver cells. Then it flows through the intrahepatic and extrahepatic bile ducts into the gallbladder. It consists of the following components: water, electrolytes, bilirubin, cholesterol, phospholipids, and salts of bile acids. All these components in primary bile are in a small concentration at first, but the longer a person does not eat, the more concentrated the bile becomes. It matters the ratio of the various components of bile for it to remain in a liquid state. In bile, cholesterol can become more than bile can dissolve. Similarly, as we can dissolve sugar in a glass with tea, and we can see that one spoonful is well dissolved, the third one is worse. When it comes to the fourth and fifth teaspoonful, the sugar falls out in insoluble crystals. The same thing happens in the gallbladder. There comes a point when cholesterol cannot be dissolved due to the fact that there is a deficiency of some components of bile. For example, there is a skewed disorder of phospholipids, and there may be an excess of bile acid salts. As a result, cholesterol in the form of little crystals is deposited on the gallbladder walls. These little crystals are then enveloped by mucus, which is present on the wall, and form a so-called sludge. It is such a sediment. This sludge can be created in people fasting for a long time. Over time, these cholesterol crystals get bigger and bigger. As a result, at one point they begin to form stones. This process takes a long time, not a year or two. It can even last for decades. At first, these cholesterol stones are very soft and can even be dissolved. But over time, calcium builds up in the cholesterol stones. They become heavy, and it is no longer possible to dissolve them. About 85% of the cholesterol stones found in the gallbladder are cholesterol ones. Sometimes other types of stones, such as bilirubin stones, occur. Bilirubin is a breakdown product of hemoglobin. Hemoglobin is broken down in the spleen from red blood cells and then, in so-called unbound form, is delivered to the liver. In the liver, hemoglobin binds to glucuronic acid and is transformed into bound bilirubin conjugated or direct bilirubin. Then it enters the gallbladder. Sometimes the amount of bilirubin in the bile increases. It happens in some types of anemia caused by increased destruction of red blood cells, or in liver cirrhosis, when the spleen enlarges and destroys red blood cells. If the amount of bilirubin in the bile increases, its solubility drops. It also begins to collect into crystals. Thus, the so-called bilirubin stones of black color are formed. In rare cases, there is another pathogenic mechanism when there is an infection of the biliary tract. Bacteria that settle in the bile ducts and gallbladder transfer bilirubin from the bound state again to the unbound state and contribute to its precipitation. Such stones are called brown stones, but they are much less common. Risk factors for gallstone disease include heredity. 25% of people who have gallbladder stones have them by heredity. Members of the female sex are more inclined to gallstone disease. One of the factors contributing to gallstones' excessive blood cholesterol levels is called metabolic syndrome. Insulin resistance, hypertension, dyslipidemia, and drastic weight loss can cause the formation of gallstones. The particular category of patients is people who fast for a long time. With prolonged fasting, there is a massive breakdown of fats and lipolysis. The amount of cholesterol in the blood can increase, and the liver begins to actively excrete it, naturally increasing the concentration in the gallbladder. According to the same scheme, gallstone disease develops in people who have undergone bariatric surgery. The essence of the operation is that overweight people have their stomachs sutured so that they eat less. As a result, the other side of the coin of this surgical intervention is gallstone disease. Disruption of the contractile activity of the gallbladder also contributes to stone formation. We see this in women all the time, in the second phase of the cycle. When progesterone levels are predominant, the contractile activity of the biliary tract drops. That promotes the formation of gallstones. In pregnancy, progesterone levels are very high, therefore cholesterol stones are formed. Taking certain antibiotics, such as cephalosporins, can also provoke the formation of gallstones. Once gallstones have formed in the gallbladder, they can lie quietly and peacefully for decades, but sometimes irritate the gallbladder walls, interfering with its normal contractility. The gallbladder walls become thickened, sometimes even calcified, and can develop inflammation. This condition is already called calculous cholecystitis. According to the processes of gallstone formation, there are 4 stages of gallstone disease. The first stage is when there are no gallstones yet. It is called lithogenic. That is, the conditions for the production of gallstones arise. The second stage is the asymptomatic stage, when there are gallstones in the gallbladder, but they do not bother the person in any way. The third stage is symptomatic, calculous cholecystitis, the occurrence of biliary colic, and acute attacks in the right subcostal pain attacks, which usually occur after meals. The fourth stage is already the stage of complications. The most pronounced complications are the exit of a gallstone, for example, into the common bile duct, and blockage, in which the outflow of bile is impossible. In this case, mechanical jaundice occurs. In other words, bile does not flow back anywhere. Bile acids, bilirubin, are absorbed into the blood. The person's skin turns yellow, and the feces, on the contrary, become discolored. Naturally, the exit of stones into the common bile duct causes severe painful symptoms. In addition, the most severe painful symptoms occur if the gallstone has risen below the junction of the pancreatic and general bile ducts. In this case, bile may be thrown into the pancreas, and pancreatic juice is activated. The pancreas begins to digest itself, which leads to pancreatitis. Gallstone disease is possible, an infection by intestinal microflora is a result of which purulent inflammation of the gallbladder may develop. It can burst, which is fraught with the appearance of peritonitis and sepsis, all the way to death. There are surgical and non-surgical methods of treatment of gallstone disease. Of course, no one wants to resort to surgical removal of the gallbladder. Therefore, many people hope that some drugs dissolve gallstones in the gallbladder. There are such drugs. They are drugs ursodeoxycholic acid. Indeed, its use contributes to the dissolution of gallstones in the gallbladder. But there is a definite condition: if they are cholesterol stones and have a small diameter. Usually, the complete dissolution of stones of small diameter, up to a centimeter, is from 6 to 18 months. But here we talk about not 100% of the disposal of gallstones. Success is achieved in about 50%. And even if the gallstones are dissolved, the probability of recurrence within 5 years is about 50%. Medically dissolving stones is possible if the so-called echo shadow is visible on ultrasound. The presence of an echo shadow is an additional criterion for the presence of a stone in the gallbladder. On gallbladder ultrasound, gallstones with and without echo shadow are clearly identified. Therefore, from the ultrasound results, it can be concluded whether this gallstone can be dissolved or not. But even if a person has started taking ursodeoxycholic acid preparations, he is still at risk until the complete dissolution of gallstones. Even a reduced gallstone, which decreased from 1 to 1/2 centimeter, can move into the common bile duct and block it, causing the consequences described above. Besides ursodeoxycholic acid preparations, there are no other methods of treatment. Surgical treatment is usually laparoscopic removal of the gallbladder. After this operation, a person lives without a gallbladder. Its functions begin to be performed by the remaining parts of the biliary system. Of course, I will make a separate video about how to live without a gallbladder. So, how can you prevent the development of gallstone disease? Knowing the reasons that can cause it, you can immediately answer the question. If it is a hereditary factor, then in principle, it is complicated to fight, but you can. At least you need to watch your weight, not suffer from obesity, from the so-called metabolic syndrome, and monitor the level of cholesterol, insulin, and so on. In cases where a person is supposed to lose weight dramatically, there is an option of prophylactic intake of ursodeoxycholic acid preparations not to form cholesterol stones. It is justified. Some people think that for the prevention of gallstone disease, they will be helped by diagnosing the contractility of the gallbladder by ultrasound. How does a person get an ultrasound in our clinics? It happens before a test meal. Then they give him something to eat with a choleritic agent. Then they look to see if the gallbladder has contracted or not. There is no such practice in the civilized world. The gallbladder contractility is determined by a completely different method, an objective one, not by eye, as we have in many clinics. For this purpose, they use a specific drug which is injected intravenously. The drug is technetium-99, a radioactive isotope. After a certain amount of this drug is injected, it is observed in a gamma camera and examined how quickly the drug accumulates in the gallbladder. Then, when it has accumulated in the gallbladder, an intravenous injection of cholecystokinin, the same hormone that stimulates the release of bile, is given. If more than 40% of the bile has spilled out of the gallbladder, it suggests the gallbladder ejection fraction is more than 40%. That is good. If there is a smaller amount of bile ejection, this is evidence of gallbladder hypokinesia. Only in this way, and not otherwise, determine the contractility of the gallbladder. Therefore, if someone suddenly writes on the result of the test breakfast that he has some problems with the gallbladder, this is a very subjective opinion. Maybe yes, maybe no. There is no accuracy in this study. Hence, another point. The dubious prescription of some choleritic drugs, which supposedly will improve health and reduce the formation of stones. What choleritic drugs are used in biliary dyskinesia? If a person was given intravenous cholecystokinin, the strongest drug for gallbladder contraction, and the gallbladder still did not contract properly, do you think that nettles or bile extract or garlic or anything else will shrink your gallbladder? Of course not. It is better to deal with those factors that provoke disturbances in the contractility of the gallbladder. Either it is hormonal disorders, for example in women, or it is again overweight. In case of pregnancy, there is nothing to do. Progesterone inhibits the contractile activity of the gallbladder. There is also an opinion that you should eat food more often to empty the gallbladder. It is not entirely true. Even swallowing saliva, drinking water still causes specific changes in the stomach, stretching its antrum. Even if you chew gum or drink mineral water, the stimulation of gallbladder contraction occurs. In smokers and coffee drinkers, the gallbladder shrinks. Therefore, people do not have such a stagnation of bile, which would lead to the formation of stones, even if they're fasting. Many people are engaged in therapeutic fasting, regularly for 24 to 36 hours. Someone fasts for a week and everything is normal. Gallstones do not form. All that has been mentioned above refers to cholesterol stones. The formation of bilirubin stones, black and brown, occurs for other reasons. Accordingly, treatment and prevention are to eliminate these causes. These are such modern ideas about gallstone disease. Thank you so much for watching to the end. Always for you, Dr. PopMed.